Hi, everyone. Welcome. Thank you for joining us. Just going to wait a couple of minutes to allow everyone to join, but thank you for taking the time to attend this webinar today. Okay, looks like everybody's being able to join. So thank you, everyone. Welcome to the webinar for Care for Caregivers webinar today. Today's webinar is on psychological health and safety in the workplace and how it plays an integral role in maintaining the psychological health of workers. We're going to hear from a wonderful speaker today who I'll introduce shortly, and I'm thankful that you're all able to join. Just want to go over a few housekeeping items. If you're experiencing any technical issues, you can send a question to me and I'll be able to help support you, or you can send an email to our webinar's email address right here, and one of my colleagues would be more than happy to help assist you. I also want to let everyone know this session is being recorded and will be available after today on our Care for Caregivers website. This free webinar is brought to you by a collaboration between Safe Care BC, the Canadian Mental Health Association, British Columbia, with funding from the Ministry of Mental Health and Addictions. And while we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. I want to start by recognizing that we are gathered on the ancestral and unceded territories of the First Nations, Inuit, and Métis people across British Columbia. We thank them for being good caretakers of this land and allowing us to be visitors on the shared territory to do good work. I want to give a quick introduction to our wonderful speaker today. Amanda has worked in the field of mental health for over 10 years, working for both government and private organizations. She joined WorkSafe BC in 2014, and since then, she has worn several hats, including case manager and claims investigation officer for fatal and serious injuries, and currently as an occupational health and safety consultant for the mental health and injury prevention. I will allow her to introduce herself and share all the details shortly, but I just wanted to bring your attention to our next webinar, which will be next week, Tuesday, and the topic will be on neurodiversity in the workplace. So I hope you can join. If you're interested in signing up, please go to the website and register there. I also wanted to quickly highlight the Care to Speak line available for anyone to call as part of the Care for Caregivers initiative. And all the details for the Care to Speak line are available again on the Care for Caregivers website, as well as the Care to Listen podcast, which just recently released its newest episode. So without taking up any more of your time, I'll turn it over to Amanda. Thank you so much for joining us. And thank you for taking the time to be here today.
Great. Thank you so much. And thanks for the introduction. So if everyone will just bear with me for one moment, I'm just going to share my screen here and get started. Okay. How's that looking, Koval? Is that all right?
Yeah, that looks perfect.
Great. Good. Well, so good afternoon, everyone. And yes, as Kuval mentioned, my name is Amanda Kumar, and I'm an occupational health and safety consultant at WorkSafe BC. WorkSafe BC is a rather large organization, as you probably know. So we've got our claims and compensation department, we've got assessments, we've got a number of different departments. I come to you from our prevention division, and that really is looking at how to prevent mental health injury in the workplace in the role that I do. And today, you know, the topic of our presentation is looking at how leaders can promote psychological health and safety in the workplace. So before we get started, I also wanted to acknowledge that I'm presenting to you from the traditional and unceded territory of the Coast Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam First Nations. So it's my honor to be presenting to you. And I should also make mention that in my role at WorkSafe BC, I also work closely with the BC First Responder Mental Health Committee. And they are a committee that came together in 2014. And as you can see on the table on the right, it's a group of about 14 first responder organizations that came together with the common goal of promoting mental health across first responder organizations. So there's representation from ambulance, paramedicine, law enforcement, policing, fire and rescue, as well as e-com and dispatch. and local government. And I bring this to your attention because some of the resources that I'll be sharing later on, there is some overlap and relatability. And so it'll be interesting for us to actually have some discussion around what resources and information may be relevant to the work that you do in your role. So just a quick mention about that. Now, what we're going to cover today is I will start with some background. We'll look at some common definitions just so we're all on the same page. We'll go over some mental health statistics across Canada. I'll also be looking at how to recognize some signs and symptoms if someone is struggling in the workplace or even outside of the workplace. We'll be looking particularly at some strategies for employers and leadership. I should mention this webinar really is designed for leaders and looking at the organizational lens on promoting mental health in the workplace. A webinar that I'll be doing in a couple of weeks, I believe on June 13th, we'll be looking more specifically at what individuals can do for themselves. So stay tuned for that one. But today, really, our focus is on looking at the organization and how to promote mental health and psychological safety as a leader. And then we'll be looking at a piece around addressing stigma. I'll be sharing some resources that you may already be familiar with, but hopefully some new ones as well. And then we will have some time for Q&A towards the end. So feel free, you can always pop a question in the Q&A box and we can attend to it towards the end of the presentation. Okay, so to get started, what are some of the statistics? So what we do know is at any given time, 1 in 5 Canadians will experience a mental health issue or illness. This is about equivalent to 6.7 million Canadians living with a mental illness every year. And in comparison, if we sort of want to gauge, 2.2 million Canadians have type 2 diabetes and 1.4 Canadians live with heart disease. So if you can sort of see in the comparison, the numbers are quite staggering when it comes to mental health and really why it's so important for us to be having these discussions today. 41% of Canadians say their mental health has declined since the pandemic. And I think, it's fair and safe to say that everyone has been impacted by the pandemic in some way, whether that's financial stress or worry about family health, planning for the future. All sorts of things have really been impacted by the pandemic. And in that, our mental health has, I think, certainly been also affected. An estimated 1 in 4 adults will experience major depression at some time in their lives. And depression is the most common mental illness, as well as the most treatable, followed by anxiety disorders. So I wanted to make a quick note about it being the most treatable, because although, we can be diagnosed with depression or anxiety, I think it's also hopeful and also something important to remember that it's also very treatable and it doesn't need to stay permanent or fixed. This is something that can be changed. And, we'll be talking about that a little bit more when it comes to some of the resources that are available. People with a mental illness are twice as likely to have a substance use problem compared to the general population. And at least 20% of people with a mental illness have a co-occurring substance use problem. So the other thing that does come up here with this statistic is it can be quite easy to fall into coping with substances when we're struggling with mental health issues, really looking for a way to escape our pain, looking for a break from the stressors. And so, we really do want to turn our mind to strategies that are healthy in terms of coping with our stressors and mental health challenges. So we'll be talking a little bit more about that as well. So why is mental health important in the workplace, and why are we having this conversation today? Really because the two go hand in hand. So to start with the definition of mental health, so that we're all on the same page, it's the emotional, psychological, and social well-being of an individual. And that affects how we think, feel, and act. It also determines how we handle stress and relate to others, as well as make healthy choices. So mental health really is about how I'm doing individually. Now, there's also mental health when it comes to the organization. And And when we talk about an organization's mental health, we're talking about the occupational culture that's cultivated in the workplace. So really, this is sort of the shared actions, beliefs, traditions, thoughts that are cultivated in the workplace, and that kind of set a tone for the organization. And that tone and that culture really does have the ability to have a positive or negative impact on an individual's mental health. So the two really do go hand in hand, and we can't really separate one from the other, which is why we're sort of talking about mental health more and more as an aspect of something that's really important in the workplace. The days are gone where we would leave our mental health at home, or even our personal issues, and that sort of follows us wherever we go. So I think we're acknowledging and addressing that more, and having these conversations that we're a whole person and we bring our whole selves into the workplace. Another definition that you may be hearing more and more is psychological safety. And this definition was developed by, there's actually a CSA standard. So the Canadian Standards Association created this definition. And basically here we're looking at psychological safety being a situation where hazards and risks to psychological well-being are assessed, and steps are taken to eliminate where possible, and minimize where elimination isn't possible, to the impacts of those risks. So what we know is that a psychologically healthy and safe workplace is one where psychological health and well-being are promoted and protected, and two, that no harm to a worker's mental health is allowed to occur in negligent, reckless, or intentional ways. Now, I should make mention that psychological safety isn't mandatory. It isn't mandated or legislated by any regulation. But what we're finding is that workplaces are adopting more of a psychologically safe stance, recognizing that this really does have positive impacts when we're looking at preventing hazards and risks to psychological safety in the workplace. The other thing that we know is that psychological health sure does have quite the impact in Canada. So the economic cost of mental illness and mental health challenges in Canada is estimated at 51 billion per year. That's a big number, right? And this includes healthcare costs related to mental health or mental illnesses, lost productivity, things that are related to health-related quality of life, those sort of indicators. 47% of workers consider work to be their most stressful part of daily life. And so, as you know, we spend most of our waking hours at work. And if that's stressful, then that sure does have an impact on how we're feeling. And it also increases our chances of having mental health issues. Approximately 25% of Canadians are affected by psychological health issues. So that's about 1 in 4 Canadians that are working are impacted in that way. And only about 23% of workers feel comfortable talking to their employer. And I think this statistic is an important one, which is, there is room for improvement, and really looking at ways to open up the conversation, making it safe to talk about mental health and to be able to seek supports when we need them. And some pieces around stress and burnout. So stress, another, typical definition that we often come across and we hear, is any type of change that causes physical, emotional, or psychological strain. And this really, stress is your body's response to anything that requires attention or action. We all have stress in different ways, right? And the way that you respond to that stress makes a really big difference to your overall well-being. So if we've got healthy coping strategies to manage stress, then, we're able to get through our day-to-day without too much issue. Now, when stress is sort of chronic, and this is the definition of burnout, particularly when the stress is chronic in the workplace and it hasn't been successfully managed with healthy coping strategies or tools and supports, then often it can show up, and there's sort of 3 different sort of signs that burnout may be sort of on the horizon. That's depletion of energy or feeling really exhausted, an increase in sort of one's sort of meaning in their sense of their work, so feeling negative or cynical towards their job, and then a reduced professional efficacy or effectiveness. So really not being able to maybe perform the way that they have in the past. So burnout is another one that we sort of want to get behind and really, adopt healthy coping strategies to prevent that from happening and taking place. Now, in relation to what I just shared, is, our body typically, has these automatic responses when we're dealing with stress. So we go into survival response when we've picked up on some type of danger or threat. We go into our fight, flight, freeze response. And in our fight, flight, freeze response, in that survival response, as you're probably well aware, there's a lot of things that are happening automatically in your body. So your heart goes up and you may be breathing heavy. Your muscles are tense. There's an increase of stress hormones, adrenaline and cortisol, and you've got these heightened awareness. And all of this is really, our ancient responses that have helped us actually survive as a species over, time. So they're all healthy and really good to be having that. If let's say we are in a dangerous situation, I sure hope that you're going to be alert and your body's going to be in survival mode, because that's what's helped protect us and keep us safe. But to make mention of this, if we stay in a state of stress, in fight, flight, freeze over prolonged periods of time, this is where our body does not get a chance to rest and recover, and where it becomes easier for us to fall into higher risk situations where we may find ourselves distracted or tired. It increases our risk of physical injury. It also increases our risk of psychological injury, because that constant stress does and can lead to burnout and things like that. So this is also why it's so important for us to be looking at stress management and supports that are available. Now, what are some of the signs and symptoms? And one of the tools that I like to share that also speaks to the full array of signs and symptoms when it comes to our mental health is the mental health continuum model. So this was first developed by the Mental Health Commission of Canada. And as you can see with this model, it goes all the way from the healthy green, as you can see on the left, and into sort of your yellow zone, which is reacting, orange, which is injured, and then into the red zone, which is kind of when we find ourselves struggling with potentially a mental illness. So with this continuum, it's great because it helps with our mental health literacy. It gives us specific, tangible ways of noticing specific signs and symptoms to determine where we are in our mental health. And I have a number of workplaces, actually also a number of first responder organizations that keep the mental health continuum model in the workplace. They post it as a way for people to speak the same language. So, if we started on the left with the healthy green, you can see in this category, this is where we've got normal fluctuations in our mood. We're calm, taking things in stride. We're sort of dealing with stress without it sort of feeling overwhelming. Here we have normal sleep patterns. We're physically active, feeling physically well, performing well at work, we're socially active, and sort of there's limited or, no use of substances or things that we are trying to numb or escape. So we're dealing with things, and that's kind of in the healthy green. As we move over towards the yellow and into the orange, you can see that symptoms start to show up where there's more nervousness, irritability. We may be experiencing more anxiety. There may be restlessness. This is also where sleep can be affected. So there may be trouble with sleep or having nightmares, incomplete sleep, feeling quite tired or fatigued. And oftentimes with this then comes poor concentration, poor performance, and where there may even be some impacts in the workplace of withdrawing socially, or sometimes people even showing up to work when they shouldn't be, but you can see them struggling. This is also where there may be an increase in alcohol use or other substances as well. as we get into the yellow and the orange. And then when we find ourselves in the red zone, which is on the far right there, you can see that this is where there's excessive anxiety. We're easily angered. We may be experiencing depressed mood or suicidal thoughts. This is also where sleep is really, problematic and very little sleep or problems staying asleep, sleeping too little. Physical exhaustion. There may also be physical illnesses that show up because our body is really distressed. And in the workplace, again, unable to maybe perform your regular duties, difficulty with concentration and things like that. This is also where we have a tendency to want to isolate and avoid social interactions. So oftentimes, wanting to be away from people and not connecting with the same supports you typically would is also another indicator that you're not doing well. And then also potentially problematic use of substances and maybe addictions forming at that time as well. So as you can see with the model, different specific tangible things we can look to determine where we are on the spectrum there. And I should make mention that we can go from a healthy green to orange and red in a matter of, an hour, sometimes minutes, depending on what we're faced with. If there's some type of crisis or tragedy, it would be normal to go from healthy green to orange or red. So I think, normal fluctuations in mood is common for human beings, depending on the situation. What we want to pay attention to is if we stay stuck in the orange or red. So if you're staying stuck in the orange or staying stuck in the red with those symptoms for a period of 2 weeks or more, and that hasn't moved, that's when it's an indicator that we want to seek some support and address those issues. So you can also see at the bottom of the table here, for every section, there are suggestions and recommendations depending on where you fall on the continuum. So as you can see, when it's healthy in the green, it's telling you, about focusing on the task and, you're breaking problems into manageable chunks. So some strategies around just your day-to-day. Now, some recommendations for if you find yourself in the orange or the red is this is where you're going to want to identify, some of maybe the causes of your distress. This is also a really good time to seek support and talk to someone. And also, if you're finding yourself stuck in the red zone, then a really important time to follow up with a healthcare provider and seek some support. Even if that meant just starting with, a family doctor or clinic, but really reaching out is an important piece here. So I think really just keeping that in mind. If you're staying stuck for a period of 2 weeks or more, this is when you might want to address some of those issues. Okay, so a question for all of you, and this is where you can maybe take a minute to think about this, but what are some signs that someone is struggling with their mental health in the workplace? How might that show up in what you see in your workers or in someone in the workplace? And feel free to put your answers in the Q&A box, and I'll have a quick look and see what your thoughts are. So I'll give everyone a minute to think about that. Yeah, that's great. Yes. Okay. So irritability, a decrease in focus and concentration. Yes. Physical restlessness, consistent sick calls. So absenteeism, definitely not showing up for work. So being distant, decreased productivity for sure. Yeah. Social withdrawal or isolation. Yes, absolutely. That's another one in wanting to sort of not be around people. Absentee rates. Yes. Excellent. Good. A decrease in performance. Yeah, this is another great one. An inability to cope with everyday tasks. So things may feel really overwhelming and poor performance. So not being able to do the job. Increased sick time, a change in personality, quick to anger. So irritability, agitation, being depressed. Excellent. Yeah. And maybe maybe particularly emotional, weeping, crying. Excellent. Thank you. All right on top of it. So I think you're all well aware that there certainly are signs that we can look to when someone may be struggling in the workplace. And as I mentioned earlier, it's normal to have fluctuations in our mood in times of stress. So as human beings, we're naturally built to experience an array of an emotions, during times of uncertainty, or even, sometimes during stressors or major change. So it can be really normal to experience things like helplessness, fear, loneliness, hypervigilance, problems with sleep. And as all of you've mentioned, some of the ways that it does show up, and we can kind of notice that in the workplace, maybe things around reduced productivity, difficulty with concentration, being late or absent. Some people, presenteeism, working too much. So staying at work, sometimes as a coping strategy, or maybe working too little and not being able to manage tasks. Social isolation and withdrawal, another one, of course, and experiencing, maybe agitation, irritability. So yes, all of you, great job in recognizing some of those things in the workplace. And some other ones, the impacts of poor psychological safety, and some pieces around, some of what we've already talked about, but, increased workplace conflict and interpersonal sort of challenges there, an increase in injuries and near misses and accidents. So this is another one. If you look at your injury rates and maybe thinking about, are people feeling psychologically safe in the workplace? Is there any correlation to that? Low engagement, an increase in claims or healthcare costs, increased turnover or more difficulty with retention or even recruitment, things like that. And productivity, we've talked about as well, customer satisfaction. And also there may be disconnect with meaning. So a decrease in creativity or innovation. So some of these are other indicators that there may be some poor psychological safety in the workplace, where there can be room for us to be thinking about how we can improve that. Now, what are some strategies for employers? And what we know is that, mental health and physical health go hand in hand, right? So when we think about our physical health, probably nothing new to you in that there's three pillars when we think about maintaining good physical health, and that's good sleep hygiene, a healthy diet or nutrition, and exercise. So sleep, diet, exercise, right, is the three pillars of physical health. Now, what we know about mental health is social support is the number one predictor of positive mental health in the workplace. And so with social support being a key predictor, what we know here then is a sense of connection, and how to boost those supports are really important. So we'll be talking about that in a couple of slides. Self-awareness and education. So things like using the mental health continuum model, or having discussions where it's easier to recognize signs and symptoms if you or someone else may be struggling, so that you're able to seek support. And then this last piece on knowing where to get help. And this is what we'll cover also when we talk about resources. So as I mentioned earlier, although it's not written in legislation or policy, it's not mandated, we recognize, more and more employers are sort of recognizing the importance of supporting mental health in the workplace. And with social support being the key predictor and sort of a really important way to improve resilience, one of the things that can be offered, and something to consider, is offering a range of support options, because what may resonate for me may be different than what resonates for you or someone else. So when we have a range of options, it allows for workers to engage and connect with the things that feel like the best fit in supporting their own mental health. So things like an employee family assistance program, if you've got that available, and where people can connect with supports through a mental health clinician. A peer support team is another one where debriefing, and I know that you've already got a number of supports within your organization, but peer support can certainly be another one that can be quite helpful as a form of social support. extended health benefits through a provider. So if there are benefits for connecting with, whether that's a psychologist, a registered clinical counselor, a social worker, that can certainly be helpful. And one of the things that we like to mention is that connecting with support early on when things are feeling fine is actually can be very helpful preventatively. So when we've connected with someone that's a good fit for us, and we've established a relationship, it can really help us if we find ourselves struggling, and now we've got a support that we've already established, someone we can trust, and we already know there's a place to connect with someone for support. Mentorship or community connection, another one that can be helpful in the workplace if there are mentors that you can seek support from. Spiritual support is another one. Actually, we have a number of first responder organizations that have a chaplaincy service or First Nations elder that workers are able to connect with as a form of support as well. And then WorkSafe BC has a number of supports that are available that I'll be sharing a little bit more about. But we do have a critical incident response program with supports there. We've got outreach and social work services, as well as prevention support. So I'll share a little bit more about that in our resource section. And some tips for leadership. So as I mentioned, in this webinar, we're particularly looking at how to boost an organization's mental health. And when I talk about organizational resilient, that's typically, what makes an organization resilient. So that's making mental health part of the safety culture. And when we're really incorporating it as something that's just as important as physical health, so mental health and physical health really being on the table, things like forming a mental health committee, or having it as a standing item in safety meetings. So really making it part of the discussion and creating a norm around talking about psychological safety can be one way of boosting an organization's resilience in this area. The other is designating a mental health champion. So if you've got someone that's really passionate about mental health and this topic, maybe has their own lived experiences, sometimes having a mental health champion, whether that's a leader or even a worker, kind of spearhead things, can also be a way to make sure that it's part of an ongoing conversation. Making mental health resources easily accessible and visible in the workplace. I think this is also quite an important one, in that, as I mentioned earlier, is when we're struggling, it can be helpful preventatively to sort of know where you're able to seek support. And if you're able to get to a place, if the resources are posted somewhere in the lunchroom, or if there's a folder or somewhere that they're easily accessible through your intra-hub or some place that everyone's able to access them, then that information can be certainly helpful when we are struggling and we don't know where to go. It can be helpful to know that there is a place for that information, that workers can seek support. Identifying psychosocial risks and hazards. And this, again, involving workers to contribute to the conversation. So really, when workers are on the floor doing the work or out in the field doing the work, seeking their opinions and really listening can be helpful in terms of creating that safety culture where everyone is coming together and having these discussions. Education and training for supervisors and managers, really equipping leadership with the skills to have conversations around mental health, and part of why we're having this conversation today. And then leading by example. So for management, leadership, finding ways to share their own sort of, personal experiences if they wish to do so and felt that was appropriate, or even in supporting each other as leaders as well. Now, this can feel sometimes like an onerous task and list, but I want to make mention that starting with even one action. So if you were to even just start with one thing and choosing one can create a shift in your organization's culture. So, it doesn't have to be all of them, but really thinking about what might be a good fit would mean that we're starting to make movement in an area. What we also know is that employers that adopt psychologically healthy practices report increased productivity in their workforce. There's an increase in retention of key personnel. So workers want to be there and they stay. There's also help with recruitment. So an ability to bring in people that are interested in the work. It also improves brand reputation and loyalty in the workforce. And then there's also, the impact of improved financial performance. So some of you may be aware of there was a study that came out, a report from Deloitte in 2019 that reported that Canadian companies that have implemented psychological safety programs in their workplace achieved a return on investment of $1.62 within 3 years. And those that had been in place for more than 3 years, having those programs in place, saw a return on investment of $2.18. So there's more and more studies showing that there sure are financial benefits to also implementing psychological health and safety programs, as well as supports for cost savings. Now, addressing stigma, and no conversation about mental health, I think, is complete without some conversation around stigma. So let me first pose this question to you and ask you, what do you think it is? What is stigma? And let's, again, we're going to use the Q&A box, and I'll give you a minute to think about that. But what do you think it is? What is stigma? Great. Okay. So it's in the mind. Yeah. And shame to share or acknowledge. Okay. Yeah. What we believe to be true until we know better. It's a negative perception or association with a particular illness or disorder. Yeah. So about perception, right? Okay. Yeah. So another one here, some people feel people who have mental health issues are just weak. A negative interpretation or societal view of an event or behavior. Excellent. Good. When people have strong opinions of something but may not fully understand. Great. Yes. Great. Okay. Excellent. Thank you for sharing preconceived notions and judgments. Excellent. All of you are on, you've heard it before, I'm sure. This is not a new term. So yes, I think, very much in line with what you're sharing is, stigma, and this is really the definition, is a mark of disgrace associated with a particular circumstance, quality, or person. And stigma can show up in a few different ways, actually. So we have self-stigma, and self-stigma, some of you have already kind of spoken to that. These are the negative views about myself around my own mental health. So if I'm struggling, this view that I'm weak, I'm not good enough, I should be stronger, what are people going to think of me? And, this shame that I might carry if I'm struggling. Now, there's also social stigma. And social stigma is the negative stereotypes held by society about mental health issues and the people that have them. So this is really, what are my colleagues going to think? What is my boss going to think of me? What are people, my friend group, or just even generally in society, really the views, and I think someone mentioned this as well, the perception of others in social stigma. So the reason I make mention of stigma as part of this presentation is because it really does get in the way of being able to seek support, right? So when we have self-stigma and there's a fear of, if I'm struggling, then I'm going to be, I feel like I'm weak and, I should be better. And I also don't want people to know this. And because I'm afraid of what they might think of me. This really can get in the way of being able to seek support or even voice if there are struggles, and maybe perhaps you need some accommodations or things in the workplace. So the stigma and promoting psychological safety really do go hand in hand. And this is where we want to normalize the conversation to make it safe. So one of the things that, going back to my work with the BC First Responder Mental Health Committee, this was, quite apparent in the work that we were doing with the first responders. And so the group came together and the committee decided to do an anti-stigma campaign. And in this, they came up with the slogan, "Share it, don't wear it." And as you can see with this poster, you'll find first responders, there's fire, there's paramedicine, there's law enforcement, there's dispatch, and there's words across all of the first responders' faces. It might be a bit difficult for you to see here, but those words are actually the words of first responders themselves. So we collected surveys where first responders talked about some of the things that they were struggling with that they felt like they couldn't share. And if I was just to read off for you, the dispatch in the middle, I feel worn down and overwhelmed. Sometimes it's hard to think clearly. I can't remember when I noticed that this changed. It sort of became normal, I guess. Really just coming from the hearts of first responders and what they were feeling. And the importance of being able to speak up about mental health. So this is where the slogan, "Share it, don't wear it," came in, where seeking support to really prevent psychological injury and to support one's own mental health came in place. So we've got these posters on our website, and I'll mention this in future slides, but just to make mention that there are organizations that are doing some work to normalize the conversation and to break stigma. And so how can we have the conversation to reduce stigma? And really, I'm sure this is some of what you're already probably doing in the workplace. So really simple conversations and checking in around, if you're seeing staff potentially maybe struggling or maybe not, really just checking in with people. So how are you doing today? Or I know there's a lot changing around us. How are you managing? If you're noticing that somebody may be struggling, you seem a bit unsettled, want to talk about what's happening, or is there anything that we could talk about? And, or potentially if you've been feeling that same way, I've been feeling so and, how are you feeling about this? So some of the ways to really just normalize the conversation and reduce stigma in being able to really connect human to human. Not sure what to say, that's okay too. So in this, we're not proposing that you become a counselor or a therapist. And I think sometimes that can be what's intimidating about having these conversations. But it really is just, this notion of normalizing and having, just the way we would talk about physical health. Can we have those conversations around how we're feeling, in terms of our psychological safety? So some things, if you're not sure what to say or the right thing to say, and you may be, finding it hard to have those discussions, things, it sounds like you're going through a lot, I'm not sure what to say, but I'm here to listen. Or, I haven't been through what you've been experiencing, but I'm here to support you. Or I don't have the answers, but here are some resources that might help. So really just being that support in having these conversations. Now, I want to make mention that it's also important when we're talking about mental health to be checking in with yourself as a leader. So are you the right person to be having these conversations? How are you feeling as a leader? If you're feeling like you're struggling, then it may be an idea to be thinking about who is the most appropriate person to be checking in with staff or to be having this conversation. So I think it really is an important piece around checking in with yourself and making sure that you're the right person to be having these conversations as well. So as a leader, and again, the best position that you're in is if you're taking good care of yourself, it helps you in taking good care of others. So starting with checking in with yourself and taking care of your own mental health, some strategies and things, again, that may not necessarily be new, but a good refresher is, and this actually during COVID, we found this particularly helpful, but now I think still relevant, is limiting your time accessing the news or even social media. So being mindful of just the way that we consume, food or water, we're also consuming information, right? So being mindful of what we're consuming and how often. So, for some people, when they were watching things that are distressing on the news, or things that are in constant states of uncertainty, like during COVID, this was really impacting how people felt. So, causing people to feel quite stressed out, or maybe having changes in their mood. And by setting some boundaries around how often you're looking, at news feeds or even social media, can certainly help with taking care of your mental health. Also potentially limiting, screen time before bed, right? To avoid having sort of those heavy thoughts or things that are out of your control on your mind before trying to be, having restful sleep. Using healthy coping strategies to avoid falling into problematic patterns. So this is sort of what I was talking about earlier, when it can be really easy for us to turn to substances when we're stressed out or struggling. And again, during the pandemic, I believe there was a statistic that alcohol consumption had gone up by 40%. This was a way to disconnect from all of the things that were out of our control, as well as for some, I think, a way to disconnect from work, really. So, especially if you were working from home, some people were marking the end of their workday by having a drink, and this would be, their start of their personal private time at home. But we want to be mindful of falling into problematic patterns as coping tools, because, prolonged use, or, when we become dependent on those types of coping strategies, they can be problematic for us in the future. So turning our minds to taking care of our physical health, things like, as I mentioned earlier, exercise, sleep, and a balanced diet, really the pillars of our physical health. And that really does go hand in hand with our mental health. And then finding ways of practicing stress reduction. So whether that's yoga or mindfulness practices, deep breathing, if it's music for you, if you play an instrument or listening to music, if you're interested in art, or really accessing any hobbies that allow you to have that disconnect from stressors, as well as if that is in fact workplace stressors. So for some, it may even be being in nature, or camping, swimming, anything that really gets you to be able to have that rest and recovery time. Paying attention to your moods and how you're feeling. And again, this is where the mental health continuum model may come in handy. Being able to gauge, am I in the green or am I orange? Am I in the red zone? Where am I, and how might I be feeling? And it very well could be, something that's fluctuated depending on what the situation is that day, but just kind of monitoring your mood and keeping an eye on that. And that can also help in, going back to what I was mentioning earlier, on whether I'm the right person to be having conversations around mental health with others that may be struggling. And then this last piece around reaching out to supports and staying connected. So as I mentioned earlier, staying connected socially is such a key indicator of our positive mental health, but it can be one of the things that we least want to do when we're struggling. Most times, for many, a lot of people are often wanting to isolate and withdraw when they're struggling. And this is really a time where seeking social support is going to help with your mental health and protecting you in that way. So on to some resources and some things that you may already be aware of, so I won't spend too much time here. But to make mention of some of the things that are publicly available. Here to Help is an excellent website that offers strategies to take care of your own mental health, as well as how to support someone else. There's a number of self-assessment tools, whether it comes to, and I should mention, this is not to diagnose anyone, right? You'd have to see a healthcare professional for that, but to gauge, where someone might sit, or where you might sit when it comes to your mood. So things around assessment of depression or anxiety, substance use, all sorts of things are on this website here. So feel free to check that out, or even make mention of that and post that if that could be helpful. The Canadian Mental Health Association, another excellent website with tools for adults, for youth, as well as workplaces when it comes to promoting mental health. The Crisis Intervention and Suicide Prevention Center, the Crisis Line of BC, which I'm probably sure you're aware of, has 24/7 support for if you or someone you know may be struggling with thoughts of suicide or self-harm. The Red Book Online is also another one that I like to make mention of, and it's because it's actually a full catalog of resources that are available through government, social services, and community. And so it ranges from everything to housing and financial assistance to things around treatment and addiction support, as well as mental health support. So it really is a full catalog. And you know, I always like to put this one in here because, of course, you know, financial stress is going to impact your mental health. Addictions is going to impact your mental health. So these things really do, you know, they intertwine. And so the Red Book Online can be helpful in those ways too. And then there is a website that offers free and low cost counseling services. And it's a full list of what's available out there. So you can check that out on that website. And then this last one is Workplace Strategies for Mental Health. And this website is an excellent resource for leaders and employers looking to have a bit of a map for making a plan towards psychological safety in the workplace. So it runs through the full gamut of assessing where you're at, being able to maybe survey and evaluate where your organization might be, and then how to implement strategies. And there's a number of tools that can help with promoting psychological safety in the workplace on that website. Okay, and then WorkSafe BC has a couple of guides that we created. Actually, this was in light of COVID. And I know the writing's too small here, so it's not with the intention of you reading this here, but just to make mention that we have a guide for employers, and this is really, you know, leadership skills and tools for leadership on managing mental health in the workplace. So as I mentioned, it was designed during COVID, but the material, the content is still very relevant today. How to have conversations, and some of the things we talked about earlier are in this guide. And then also some resources that employers can refer workers to should they be struggling. Addressing mental health effects for workers, that guide there is the individual strategies that a worker can take to take care of themselves. So this is the piece around building resilience through coping tools and things that someone can do individually. And there's also a piece in that guide around how to support a colleague or a coworker, as well as resources there. WorkSafe BC also has a number of resources that you're all that are available to all of you and you have full access to. We have a crisis support line, and this is available to really anyone. So if you or a family member is in an emotional crisis, so if a worker is struggling, there's 24/7 support available through our crisis support line at that number there. And, you know, just to make mention that this is an excellent service because it doesn't require a claim. It doesn't require that you file for some type of, you know, injury. It really is just support that's available and can be accessed confidentially, you know, with confidentiality, and you can remain anonymous. So it doesn't require starting some type of claim or file with WorkSafe. We have our critical incident response program, and that is a support for if someone has witnessed a workplace accident or fatality or near miss. So anything that could potentially be a critical incident in that way, we have a team of specialists, mental health clinicians that are available at that phone number there. And we do also offer debriefings. So if there is some type of critical incident, there's support for diffusing and debriefing as well. Our claims call center, of course, if you've experienced a workplace injury, whether that's physical or mental health, is available at that number. And then we do have our prevention information line, and that's access to any information around occupational health and safety law or processes. So anything around regulations, anything around sort of, if you're looking for, you know, the codes or policies or law, this is a good line to access that information. Now, some of the resources and what I spoke about earlier when it came to our BC First Responder Mental Health Committee, here's the website there at bcfirstrespondermentalhealth.com. And there's a number of excellent tools and resources on the website too. And as I mentioned, there may be some relevance in the work that you do, in that, there's self-assessment tools, there's things around supporting colleagues, there's a full section on tools for leadership, on promoting mental health, having conversations, addressing stigma, return to work processes, talking with family, all sorts of things there. So feel free to check that out. I think that could potentially also be a great resource for you. And then on that same website, just to make quick mention, we've got a supervisor's guide. And again, this was created by our first responder committee, but, very relevant, I think, here as well, and can be used across sort of industries and within healthcare. And in the guide, there's really understanding mental health. The continuum model is in there as well that I had showed earlier, having a conversation and some suggestions around that. And then, some pieces around resources and being able to navigate those conversations as a supervisor or a leader. There's also some tools around return to work and workplace accommodations after having struggled maybe with a mental health or psychological injury. So the role of a supervisor, we've got a guide there. We've also got some excellent suggestions when it comes to accommodations in that guide where you can see on the left there. So all of these guides and tools, again, found on our website at bcfirstrespondermentalhealth.com. And then this last one that I want to make mention of, and some of you, again, may be aware of, and it's called Guiding Minds at Work. It's an excellent resource website there. It's a free set of tools that assesses and implements psychological safety in the workplace. So lots of information I know that we've covered today, but for example, if you wanted to go somewhere just as a way to start with promoting psychological safety and being able to assess where are we in our organization, where do we begin? This can be a good place to start, where you start with doing a bit of a scan, and you understand, you identify the risks and hazards to psychological safety in the workplace, and you kind of create a plan, and it gives you all of the steps to be able to promote mental health and really, support that piece in the workplace. So another excellent resource that's available to all of you in the work that you're doing. Okay, so I know we've covered a lot. And with that, maybe I will open it up for questions, and I will also have a quick look to see if there's anything in the Q&A box here. Okay, so thank you. I see that there is a wellnesstogether.ca website. That's a great resource as well, and that's no cost. Yes, excellent. Thank you for sharing that. So that's another great one. There's a question around, is watching your favorite TV shows an unhealthy stress reduction technique? I think, I guess it would depend on, what you gain from that, and also for how long. So that would really, I think, be sort of a personal question on, are you finding it to help with your stress, as well as, what are the costs and benefits to that? So it can be, I should say, it depends, maybe, is my answer.
Thank you so much, Amanda. I'm just mindful of the time. I just wanted to make note to everyone that all the wonderful content covered today, as well as the resources that were talked about, everything in the recording will be available on the Care for Caregivers website after this webinar is finished recording. As well, I wanted to just mention quickly, and also Amanda mentioned earlier, was that not next week, Tuesday, we have a neurodiversity webinar for Care for Caregivers, but Tuesday, June 13th, Amanda will be back. She's gracious enough to spend some more of her time with us to discuss mental health and resilience for frontline workers. So that will be specifically targeted to frontline workers. We encourage everyone to register if you haven't, or forward it to someone who may benefit from it. And I'd like to take a minute just to thank Amanda for all the time that you spent with us today and the wonderful information you shared. Very much appreciated. and so many amazing resources shared and strategies that I'm sure will be helpful. And I want to thank you until the next time we see you, which will be June 13th. I appreciate your time. Thank you very much.
My pleasure. Thank you. Thanks for having me.
Have a wonderful day, everyone. Thank you, and we hope you come back soon for our next webinar.
Thank you.